Hi, this video, the art of hair transplant restoration surgery. Result 1 year post-op with before and after photo by Dr. Diep. This client had a really traumatic change. He had a procedure done before by another clinic, and it really still very thin and sparse, and his hair angles all over the place. Not very congruent, and then the hairline's a little bit high, and the temple, they still left it really wide, so he has a really wide forehead. He could not leave his hair long before. Why? Because the top, the volume is so low that if you leave it long, only this side had bushy out on the top. So now, with a full set of hair and excellent density, and I brought in the temple at least an inch on both sides, and then recreate the hairline very natural for him, and a nice zigzag, and he walked down the street. No one can tell he had surgery. Even I had a hard time recognizing who it was by a sudden change of the hairline. And you talk about maybe 1 centimeter down, or 1.5, but then the temple changed. It's really, he's already a good-looking guy, but what happened, and his excellent feature, when you had a perfect hairline and bring in the temple and frame the face, it really enhances his eyes, his nose, and all the features that God created for him. Last year, when he lost when his hairline wasn't perfectly aligned, it was really high and it's really wide. It really threw off his look. It's like a V pattern, really big forehead. But once we frame it right and more aligned, perfectly parallel, it completely changed him. And that's where he is now. And I'll show you what he was before. It's poor density, and again, that's just with one surgery already. And hair angle was all over the place, and he had difficulty wearing his hair. He got stuck because he can't wear his hair long, because all this is poor density and then thick bushy on the side. So a year later, and we fixed the hairline, excellent volume and density. Again, on the right hand side, we're moving at least an inch and a half. And again, the hair side temple is flat against the skin backward, but mostly root to go single hair, on a rare occasion 2 hair. And a year later, see how nice and soft we brought in at least an inch, and now it has excellent volume and density. That's why he can wear his hair longer. And again with this, and you see how awesome the density is and the volume of his hair now, and you can see how thin all throughout. And a year later, before, after, before, after. Again, hair transplant, again, is not just the surgical skill of the surgeon. You see how nice, and it's the whole artistry behind it. From the eyebrow to the hairline is around 6.5 to 7 for Asian, and black and Caucasian is around 7.5 to 8.5 centimeter. And this is where he is now. And thanks for at least allowing me to show his hair. I wish he can let me show the full face, because you know he has a really good feature, and it really enhanced my work by being able to see the full face. So maybe in a year or two, or somewhere down the line, he is brave enough to let me show the full face. So you can see a big drastic change. But at least suffice to say now, he has excellent volume, excellent thickness, and the hairline, look at that, is, you know, and then there, and excellent nice zigzag, and the temple hair gone very flat against the skin. All these has excellent volume, fantastic result. And this is my work. Thank you.